special webinar to recognize the launch of the publication by the same name. So we have a jam-packed session. Let me go ahead and go over some housekeeping messages before we begin. The session is being recorded. We do have simultaneous interpretation available in English and Spanish today. You'll see the interpretation button at the bottom of your screen. If for whatever reasons you are having difficulties seeing the icon or getting it to work properly, we recommend updating the version of Zoom that you have on your device for future webinars. Throughout this webinar, we will not have the possibility of asking live questions, but we do have a Q&A box available below in the application menu. So if you ask any questions, we'll try our hardest to answer all of them either live during the Q&A or in the Q&A box. Let's quickly go over the agenda. We're starting with some housekeeping messages and opening remarks, and then we will follow with some presentations from three very important guests. After our presentations, we will have ample time for some comments and wrap up with a Q&A session and some closing remarks. So without further ado, I'm going to introduce Dr. Anselm Hennis, Director of the Department of Noncommunicable Diseases and Mental Health at PAHO, for some opening remarks. So Dr. Hennis, the floor is yours.
Thank you so much, Julia. Good day, colleagues, ladies and gentlemen. On behalf of the Pan American Health Organization, it is my pleasure to welcome you to our webinar with the purpose of launching our recent publication, Comparing Taxes as a Percentage of Sugar-Sweetened Beverage Prices in Latin America and the Caribbean. Non-communicable diseases are the principal driver of morbidity and mortality in the region of the Americas, posing a major public health challenge and threatening critical social and economic development. Unhealthy diets are a key determinant of the NCD epidemic, and therefore a central pillar of our work here at PAHO involves supporting policies that can help populations improve their diet in order to protect the public health. As such, the Economics of NCDs and nutrition teams in the Department of Noncommunicable Diseases and Mental Health are committed to strengthening capacity of member states to generate and use economic evidence and policy tools to protect healthy diets and public health. In recent years, there have been increasing requests for technical support and taxation of sugar-sweetened beverages as part of a package of evidence-based policy interventions to reduce rates of diet-related non-communicable diseases. Since 2016, the Economics of NCDs team, together with the nutrition team, have made demonstrable advances on sugar-sweetened beverage taxation in the region, a key lesson learned from tobacco taxation and the significant progress achieved in the past decade in positioning this as a major public health tool has been the need for periodic standardized monitoring of tobacco tax levels, prices, affordability, and tax structure and administration. These lessons are all similarly applicable to sugar-sweetened beverage taxes. Now, beginning with the country-level collection of prices and tax legislation, the PAHO teams produced data characterizing the design of excise taxes on sugar-sweetened beverages in Latin America and the Caribbean. This new information on the implementation of sugar-sweetened beverage taxes also provided insight into the gaps in excise tax design and whether they were aligned with health goals. Now, working in coordination with global specialists and regional experts, the PAHO, Economics of NCDs and nutrition teams then developed a methodology for estimating a tax share indicator and other tax policy and price indicators for selected sugar-sweetened beverages based on the methodology used by WHO to monitor prices and taxes applied to tobacco products. This work subsequently led to the publication we are recognizing today, the newly developed estimation of a region-wide standardized and comparable metric of tax levels applied to sugar-sweetened beverages. We are all immensely proud of this work, which will contribute to fulfilling PAHO's commitment to member states and advance country actions towards achieving the targets laid out in the 2030 Sustainable Development Goals. As a true regional public good, the tax share indicator will enable the analysis of trends in sugar-sweetened beverage taxation and promote the establishment of best practices. We are also pleased to share the news that WHO intends to translate this regional public good into a global public good available to all WHO regions. This development will advance global progress on reducing rates of diet-related NCDs and ultimately promote better food systems and healthy populations. I congratulate the colleagues who have led this pioneering work and look forward to the regional and global benefits that we anticipate as a result. Welcome to all.
Thank you again, Dr. Hennis, for joining us today and for that wonderful introduction to the topic. Always a pleasure having you open the floor for our webinars. So our next guest, Dr. Rudiger Kretsch, Director of Health Promotion at the World Health Organization, unfortunately could not be with us today to participate live, but he did record a video for us to watch together. So let's take a look.
Good morning, esteemed colleagues. I'm delighted to welcome you along with Dr. Hennis to this virtual launch of the publication on comparing taxes as a percentage of sugar-sweetened beverage prices in Latin America and the Caribbean. We all know that non-communicable diseases such as cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases are the leading cause of death and premature death worldwide. We also know that one of the 4 major modifiable behavior risk factors of NCDs is unhealthy diets. As rates of diet-related NCDs and obesity have increased throughout much of the world, there has been a growing interest on the role that sugar-sweetened beverage play in these concerning trends, largely because these beverages are a primary source of consumption of free sugars in many countries. Their consumption is associated with many diseases and health conditions, and because they have no nutritional benefits and are neither an essential nor desirable part of people's diets. In parallel to the rise in consumption of SSBs, there has been a general rise in the affordability of these products and a growing interest of member states in using excise taxes to curb their consumption. To date, over 80 countries have taxation measures that apply to SSBs. However, the design of these taxes, including which products are taxed, the type of and rates applied differed widely from country to country. And as we have learned from the experience in monitoring tobacco taxes in a standardized manner across countries since 2008, not all health tax policies are created equal. The design of the tax is fundamental for achieving the desired public health goals. PAHO's pioneering efforts in creating a comparable metric of tax levels of SSB taxes sets forward a new path for performing standardized cross-country comparisons and collecting information that can contribute to identifying best practices in terms of SSB tax designs to advance public health. As we have learned from the experience in tobacco, a standardized tax indicator that allows countries to track progress across time and compare progress with other countries has been a powerful tool for informing best practices at an international level and for advocating for improvement in tobacco tax policies at a country level. For example, part of the motivation for the 2017 tobacco tax reform in Colombia, which essentially tripled the rate from 2016 to 2018, was that Colombia had the second cheapest cigarettes in the Western Hemisphere, second only to Paraguay, a large producer with notoriously low prices. The article published today provides member states in the Americas with a tax share indicator that will serve as a powerful advocacy tool for improving the design of SSB tax to amplify the public health impact. At a global level, we are now undertaking similar efforts to provide member states in other regions with the same type of intuitive indicator. As adoption of taxes on SSBs grows globally and more comparable information becomes available, the evidence base, lessons learned, and best practices will continue to become more robust. With that, I wish you all a very productive launch and hope that the indicator that will be presented here today will contribute to tangible advances in health, revenue, and development in your respective countries. I thank you.
Thank you to Dr. Kretsch for his video, even though he couldn't connect today. Perfect segue to our presentations. And it is with great pleasure that I introduce my colleague, Rosa Sandoval. Ms. Sandoval has been with the Pan American Health Organization as the advisor on tobacco control, where she's responsible for providing technical cooperation for the implementation of the WHO Framework Convention on Tobacco Control in the region of the Americas since 2003. Ms. Sandoval also leads the team on Economics of Noncommunicable Diseases with the objective to facilitate the generation and use of sound evidence supporting policy coherence aimed at curbing the NCD epidemic. Ms. Sandoval is a public administrator from the Maxwell School of Citizenship and Public Affairs at Syracuse University and a former Desjardins Class Fellow. She also holds a degree in economics from the Pontificia Universidad Católica of Peru, her home country. And prior to joining PAHO, Ms. Sandoval worked in Peru's Ministry of Labor and Employment, Ministry of Social Development, and the Promotion of Women and Ministry of the Presidency in the areas of public health, population, youth, and social development. She's currently leading applied research on monitoring health taxes, drawing lessons from tobacco tax indicators to alcoholic and sugar-sweetened beverages. And in recent years, she had published on using economic evidence to support policy decisions to fund interventions for non-communicable diseases, the use of excise taxes on sugar-sweetened in Latin America and the Caribbean, and how raising tobacco taxes in the Latin America and the Caribbean region will generate extra tax revenue. So Ms. Sandoval has also coordinated and acted as technical editor of the thematic issues of the Pan American Journal of Public Health on economics of non-communicable diseases and on economics of tobacco control in the Americas. So Ms. Sandoval, please go ahead.
Muchas gracias, Julia. Buenos días con todos. Realmente es un placer enorme para mí estar en esta.
Thank you and good morning. Very much. It is a pleasure to be with you this morning. I wanted to tell you a bit about the results in terms of the tax share of SSB prices. So I'm going to ask you to show my slides. And as I was saying, the whole objective today is to share with you the efforts that have been made behind the calculations that are going to be presented today. So if we can go to the next slide.
La siguiente, por favor. Este trabajo empezó en el 2015.
These efforts began back in 2015, basically almost 10 years after PAHO, as part of the Tobacco Framework Agreement, went into effect when they began to charge taxes on tobacco. So back in 2015, we identified a technical assistance line to see what lessons we could draw from tobacco taxation something that could be applied to SSBs. And I'm sure that many of you, the 160 people that are here today with us, know that this is something of great interest, both for the population in general and for health authorities, as well as fiscal authorities in our countries. Now, why is it important to monitor SSB taxes? How can we identify lessons that have been learned thanks to our taxing of tobacco? First of all, it enables us to assess the multiple dimensions of taxation policies, not only the fiscal objectives, but also the health objectives. And also it facilitates a standardized comparison. That is something that was said by both of our speakers this morning. It facilitates a standardized comparison across countries. You know that can be important, but also it provides for comparisons over time. Now, I am fortunate because I have been working with PAHO for a long time, working with fiscal authorities, for example, and they always ask us what is happening in the rest of the region. Or they will say, okay, how does my country stand in comparison with the other countries in the region? This type of indicator allows us to answer that question. And also it gives us institutional information for decision-making. It detects opportunities or barriers to applying this type of taxation policy. And of course, as these measurements, as these calculations are done over a significant period, this feeds into our design of policies. We can see what type of tax structure, what level, what type of tax, should it be an ad valorem tax, what type of tax allows us to best accomplish our policy objectives in both health and fiscal arenas. So this is a very helpful tool to provide technical assistance to our member states. And there is a great appetite for this in the region. And of course, it provides us with powerful tools for advocacy. And it can be used not only by those designing policies, but also within the ministries. We hope that this will be helpful for technical teams, so technical teams can justify their tax proposals and also to provide for a multi-sectoral discussion. So in this way, E&T in PAHO is looking at providing for multi-sectoral intervention. So we need tools that provide for multi-sectoral discussion. And in this case, we need policy consistency between fiscal and health policy. Here you can see how this work began and where we began back in 2016, where we did a review. We assessed the different tools that WHO has to monitor taxes as well as prices of both SSBs and alcoholic beverages. Back in 2016, we did a pilot to gather information. We used that as a point of reference. We looked at the experience that had been gained by taxing tobacco, and we had a first draft, a methodology that would be standardized for tobacco taxes. We are going to hear today from someone that led that work. That would be Marita Lucci. And we learned a lot from their experience. And we gathered that information. We began to prepare a draft of methodology for these other products that are quite different from tobacco products, obviously, for different reasons I don't intend to get into now, but Maxime Roche, I'm sure, will be talking about this. In 2018, we did a regional meeting to review this pilot and to put this methodology to the consideration of international regional experts looking at experts in tax issues, bringing them together with people that work in the area of nutrition and alcohol. In 2019, we launched a survey to gather information on taxes and prices of SSBs in the Americas region. And in 2020, we launched that survey for alcoholic beverages. And next year, we hope to have a webinar like this one, or perhaps an in-person meeting where we can present this information, or later this year, maybe. And in 2021, we began to see that this work was paying off. We published an overview of the tax design for SSBs in the region. That is something you can find on our website. And we published a reference document on taxes on SSBs. And we also published a methodology that we have developed here in PAHO to calculate the of the tax share. So all of these publications can be found on our website, and I'm sure that the colleagues will be sharing that today. So here we are very proud to be presenting this regional calculation for 2022. And we're very happy to hear that in 2023, perhaps, and we're working with our colleagues at WHO so that this can be scaled up to the global level.
Para terminar, básicamente,
to conclude, basically around this topic and on this particular work, there are three things that I would like to mention before giving the floor to Maxine, who's going to talk about outcomes. First of all, this work showed that taxes on SSBs exist, and the situation is similar to what we saw on alcohol and tobacco taxes. That is to say that taxes do exist, however, they do not have health outcomes in mind. And that kind of changes the conversation in terms of our public health policy, because it's not about introducing a new tax, but rather it's a conversation about designing these taxes better so that they can address both the fiscal needs as well as the health needs. And overall, they contribute to SDGs because they result in better health outcomes and therefore better outcomes in terms of economic development. So what this information enables us to do is to have a better picture so that both health and economic authorities can hopefully shape policies more efficiently and coherently. And finally, the idea is that the method that we are presenting today could be replicated, because since we did this at the regional level, we believe that this is a feasible method that correctly informs monitoring of this policy as well as any future developments around this policy. And my final slide is to thank everyone that either are or have been part of both the economics of NCDs as well as nutrition and physical activity teams at PAHO, who since 2016 have been part of this effort. Thank you very much.
Thank you to Ms. Rosa Sandoval for that extremely insightful presentation and dive into SSB tax share conceptualization and especially PAHO's work on monitoring health taxes. I'd now like to introduce our next presenter, Mr. Maxime Roche. Maxime is a postgraduate researcher and PhD candidate in health economics at the Center for Health Economics and Policy Innovation at Imperial College London, sponsored through a studentship by the United Kingdom's Economic and Social Research Council. His research focuses on the economics of NCD prevention policies, particularly fiscal policies to promote healthier and climate-friendly diets. Maxime was a consultant in the Economics of NCDs team at PAHO for 3 years and has also been a consultant for the World Bank, WHO, and Vital Strategies, particularly working on tobacco, alcohol, and SSB taxes. He holds an MSc in economics from the University of Amsterdam in the Netherlands and an MSc in corporate finance from EDHEC Business School in France. Mr. Roche, the floor is yours whenever you're ready.
Thank you very much, Julia. I'm going to be sharing my screen here. Okay. So thank you very much, and I'm delighted to be here and presenting the result of this extensive work that started back 2015, as I was saying, and this survey back in 2019. So I'm going to be presenting the final result, but first dive into a bit of the methodology. So about the data we collected and the survey. So we launched an online survey to all the member states in the PAHO region. We got 27 out of 33 PAHO Latin American and Caribbean member states to answer this survey between March 2019 and December 2019. All the survey respondents were officially nominated by the government, either from the Ministry of Finance, Ministry of Trade, or customs officials. We surveyed, our survey was based on 5 non-alcoholic beverage categories, and I will detail in the next slide which categories were part of the survey. In addition, the price were collected on the most sold brand and on the cheapest brands, mostly for sugar-sweetened carbonated drinks, from supermarkets and from an independent small grocery store. We also collected price and product characteristics like volume, size, or sugar content, because it's important in applying such taxes. We collected tax data and mostly tax legislation, and we use this tax legislation to cross-check the information that were provided by survey respondents and cross-check our results and how the structure applies or how the tax is designed on sugar-sweetened beverages in every country. And then we also created some tax policy indicator using some information on adjustment to inflation or minimum tax policy or price policy. And finally, we looked at tax revenue and earmarking. So the beverages that we selected, so we selected sugar-sweetened carbonated drinks and fruit drinks because they represent the most sold sugar-sweetened beverages in Latin America and the Caribbean. For sugar-sweetened carbonated drinks, we use Coca-Cola as an internationally comparable brand because it was found to be the most sold brand in most countries in the region and also present in every country in the region. We selected also energy drinks because the volume sold of energy drink has tripled in the last decade in Latin America. For sugar-sweetened milk drink, we selected them because they promote an increase in free sugar intake, particularly among youth, adolescents, and children. And finally, we selected bottled water as a comparison, as a non-SSB, to compare tax levels between SSB and non-SSB. So as you see, except for sugar-sweetened carbonated drinks, where we selected the same brand in every country, we selected the most sold brand respectively in every country for all the other beverages. And this most sold brand were either selected based on national level market share data, or by surveying store owners, the survey respondents surveying store owners to find which brand is the most sold in the country. And we then standardized beverage sizes that you can see listed here in order to compare between countries using either market share data when it was available in every country, or looking also at the volume sizes that we received in that round of data collection in this survey. So the method in a nutshell. So I'm not going to enter into the detail in every tax, but here this is the main formula for the tax share indicator, and it's pretty straightforward. It comes from the definition of the tax share by WHO for tobacco taxes. So it's the sum of all indirect taxes applying on sugar-sweetened beverages divided by the final retail price. So the most important type of taxes that we're going to focus today and that our publication focus on is excise taxes, because from a public health perspective, it's the most efficient because it allows policymakers to target sugar-sweetened beverages and increase their relative price compared to other goods or services in the economy. And we also include, of course, all the other indirect taxes in our total tax share indicator, which are VAT or sales taxes, import duties, or other taxes like environmental levies or customs charges. So here, I'm going to go very fast. For VAT and amount-specific excise taxes, it's pretty straightforward the way we calculated our indicator. For VAT, most of the countries apply a VAT on the final retail price, excluding this VAT. So that leads us to this simple formula. We also, of course, in countries where it was not the case and where they had a specific tax structure in their sales tax mostly, we took into account their specific respective structure. For amount-specific excise taxes, they are divided into two categories, the one that are volume-based, so meaning fixed amount applies to per liter or per 100 milliliters of beverages. So then we use that taxable unit volume and the amount of tax per volume. And for sugar content base, we collected the sugar content in the beverages along with their price. And then we use that sugar content in order to calculate the amount specific excise tax when it was defined this way. For example, let's say $1 per 10 grams of sugar per 100 milliliters. For ad valorem excise taxes, it was a bit trickier to calculate the tax share. And why is that? Is because, particularly for locally produced beverages, because basically an ad valorem excise tax applies as a percentage of the value of the product. Here, the base M, which will be that value. And in most cases, this base is the retail price, which then is really easy. That's what we collected, or the retail price excluding VAT or excluding VAT and excise. And in that case, it's pretty straightforward. In the case where the base M is set early in the value chain, like the producer price, meaning the price when it exits the factory, then it gets trickier for us to estimate starting from the retail price that we collect. So we then need to subtract VAT, excise taxes, the margin of the wholesaler, the margin of the retailer. So that leads us to that formula that you see here, where pi represent this distribution margin that we don't know about from the retailer and the wholesaler. So we have to assume something about it. And in most cases, in most countries, we do not know what's the level of this margin, the average level of this margin. So we could assume that it's very small if the market is very competitive, but this could overestimate the base and then overestimate our indicator in the end. Or we could assume it to be very high, but then that will underestimate our final indicator, it mostly and even more in countries where the market for SSB is very competitive. So after we did a round of consultation with WHO experts and external experts, and we decided to assume these distribution margins to be 20% in total. And because we apply this assumption to all countries that apply the producer price, and it's only 5 in the region, so it's not on every country, because we apply this same assumption for all those countries, that allows us to compare the final indicators. And it allows us also to make fairer comparisons with countries that apply that tax later in the value chain, and which results in a higher tax share for those countries. For imported beverages, it's easier. It's the same way. It's a percentage of the value of the product, but this value is usually based on the import value, called the CIF value, or the CIF value plus the import duties that are applied on that beverage. And for that, we have database that exists on trade information from which we can take this CIF value. So, and finally, for the last two type of taxes, for import duties, it's easy. It's just, again, like for import duties, for imported beverages that we just saw for ad valorem excise taxes, for import duties, it's the same. It's a percentage of the value of the imported value of that good. And again, here we use the CIF value. And when there was a case of trade agreements between countries, we took the lowest possible rate in that trade agreement, and we respected the trade agreement and took into account the import duty rate that was given to us by survey respondents, and took into account also these trade agreements. And it's important to mention it. Finally, for other taxes, they can be of different types, mostly volume-based or ad valorem. And in that case, again, following what I presented before for the other taxes, it's pretty straightforward to calculate it. So we needed other data sources, of course, than the survey in order to make these indicators comparable and to also calculate those indicators. So particularly, we used a lot of tax legislation that was collected before by PAHO and WHO, particularly VAT tax legislation that was already collected for the report on the global tobacco epidemic by WHO to create the tax share indicator for tobacco. We use IMF databases, classic databases to use for exchange rates and purchasing power parity conversion rates in order to compare countries in the same currency unit. And finally, as I was saying, we used a trade database, the United Nations Comtrade database, to get this CIF value, those import values for those beverages. And then very important in that methodology is that we went through a lengthy validation process. So we sent our final estimates and our final indicators to the respective governments for their review and their sign off on those on those estimates between June 2020 and April 2021. And in the rare case where national authorities requested change, we assess them, their request, and according to the legislation and any additional information, clarification they could give us, we made some changes or discussed with them about our estimates. Of course, like any methodology, any method, there is some limitations, and the limitations here are mostly due to the fact that we try to harmonize our indicator, and we have we cannot ask for I don't know, 10 price points for every beverages, of course, to not overburden the survey respondent. So we have the limited data also. So the first main limitation is national representativeness of our prices. The prices were mostly collected by people working in the ministries, and mostly they are based in the capital city, so it might not be fully representative of the country as a whole. It's mostly collected from supermarkets, and in some countries, supermarkets might not be the most representative retail chain. And then some country also sometimes did not have market share data. So to select the most brand, as I was saying before, they had to audit some stores and could not have a broader picture at the national level of the most brand. Also, we had to standardize volumes, of course, to be able to compare our indicators. And we use the linear transformation, but we know that when the volume of a beverage increases, the price per milliliter of that beverage tends to decrease, meaning you pay less per quantity when the volume size of a beverage increases. So then that might have biased our indicator. Finally, the C value, as I was saying, used from that Comtrade database, this UN database on trade information. The problem with that database, when you want to look at very disaggregated products like sugar-sweetened beverages, is that it's hard to identify these exact products because the way the tariff codes are defined, they are not defined to know if a product has sugar in it. It's defined to be used for trade purposes, so it's quite aggregated and sometimes hard to understand which beverages are with sugar and which are not, or which are sweetened, which are not. But since we collected and we did our analysis on the Mosso brand, as I was saying, the brand that is represented in each of those tariff codes is mostly the Mosso brand by definition. So we're fairly sure about our indicators and the representativeness of the C value that we obtain. And again, thanks to this database, we could also look at trade information between two given countries. Final limitation is this distribution margin assumption that I just discussed, but this only concerns 5 countries, and as I was saying, and only on the ad valorem tax component. And this 20% assumption is quite sound when in the small amount of information we could find in the literature, we're finding profit margins and retailer and wholesaler margin between 5 to 7% in Chile, for example, 20% in Mexico, and I think around 28 to 30% in the US. So our 20% assumption seems really sound. So let's now dive into the findings. So first, let's look at how the region compares to other regions. So here you see the green bar, the sugar-sweetened beverage taxes, in blue alcohol and in orange tobacco. And you see on the left all the region of the WHO region. And what we see is that the America is the region with the most sugar-sweetened beverage taxes implemented, 21 out of the 35 countries of the region as a whole, and 7 jurisdictions in the US also applied taxes on sugar-sweetened beverages. So this is clearly promising. But let's look inside the region and inside Latin America and the Caribbean, particularly for this publication. 21 out of 33 PAHO WHO member states in Latin America and the Caribbean, 15 out of 19 in Latin America, but only 6 out of 14 in the Caribbean, and we had some data missing for Haiti there. So even though it sounds promising, 21 out of 33, as I was saying, most of these taxes are not optimized from a public health perspective. So now we're going to look at why we're saying that and what do we see in our results. So first, let's look at the design of these taxes and what beverages are covered in these taxes. So as I was saying, many of these excise taxes have been implemented without a health rationale. And one big example of that is what I show with the arrows here on the right of your screen, is that 7 of those excise taxes that apply on sugar-sweetened beverages in Latin America and the Caribbean apply also on water. So it clearly does not incentivize consumers to switch to the healthier alternative that water represents. A second finding that we have is that all sugar-sweetened beverages, excise taxes on sugar-sweetened beverages apply also on energy drinks, but at least 5 do not apply on fruit drinks, at least 6 do not apply on concentrates, powders, and syrups, and at least 5 do not apply, and only 5 apply, sorry, on sugar-sweetened milk drinks. And all those products that I just cited are SSB, and therefore an excise tax on SSB should apply to those products. If not, it can incentivize some negative substitution between products as a consequence of a tax. So once again, even if 21 countries apply excise taxes on SSB, we can clearly see that that most have been used mostly as a tax revenue tool more than a public health tool, and most excise taxes could be improved. So let's look now at the type of excise taxes that we have in the region. So they are very diverse. We have 10 countries exclusively using ad valorem taxes, so as a percentage of the value of the product, of the price of the product. 7 exclusively rely on amount-specific excise taxes, and in Dominica and Ecuador they use a combined structure with some beverage types taxed under a specific tax and some under an ad valorem tax. And in Mexico and El Salvador, they use a mixed tax only on energy drink, meaning ad valorem and specific applying on energy drinks. So more than half of the countries have varying rates between SSB types. So that means a tiered design, but these design are mostly based on categories. So meaning, for example, a rate could apply on fruit drinks and another rate on sugar-sweetened carbonated drink. And they are not applied, mostly they are not applied based on the sugar content of the beverages like it is recommended. So here you see circled only Chile, Ecuador, and Peru, which are countries where sugar content is taken into account in the definition of the tax. So in Peru and Chile, we have tiers that define the different rates that are defined by tiers, and those tiers are defined by threshold of sugar concentration inside the beverages. And this has been shown, for example, with recent evidence in the UK to promote reformulation for the industry, that the industry tried to avoid the tax or tried to go below those thresholds and therefore reduce the sugar content inside the beverages. And then we have Ecuador, which is one quite unique structure, which applies an amount per gram of sugar. So it's very proportional to the amount of sugar in the beverages. And what WHO recommends is as a whole to apply taxes based on the sugar content, to differentiate and have higher rates applied to higher amount of sugar, and for it to be, if not proportional, at least that beverages with higher sugar content are taxed higher, and their price is therefore higher. So we also looked at for ad valorem taxes, as I was explaining in the methodologies, that it matters where the tax, at which point in the value chain the tax is applied. So here we see that in 5 countries, the point where it is applied is not close to the retail price, but very early in the value chain, which is here the producer price, meaning the price when it exits the factory. And because this price is lower, because it's before all those margins and all those additional taxes that will apply, it makes the final impact on the price it makes a lower impact on the price. The tax has a lower impact on the price because of that smaller base. So, and it's also sometimes easier for the industry to do some pricing strategy to avoid the tax when it's that early in the value chain, and then pass it less to the consumer. And finally, one other indicator we looked into, which is a very important one, and even more right now with high rates of inflation, it's if amount-specific taxes, so taxes that are based on fixed amounts per volume or per sugar content, if they are automatically adjusted for inflation. And we find that was the case in only half of the countries in the region, and that means that some of those taxes may decrease in their real values through times, while prices in the economy in general increase. And we also looked at other type of policies that will apply not only excise taxes, but also if there are some other mechanism like minimum amount specific taxes. What are those? Is when you have an ad valorem tax. And you want to disincentivize the consumption of cheap beverages, because with an ad valorem tax, the cheaper the baseline price of the beverage is, the lower the tax will be, the tax to be paid will be. So then you might want to have a minimum amount specific tax, which kind of represent a minimum tax to be paid on every beverage. And we find that in Brazil, the country applies such minimum amount specific tax per liter, and also depending on the type of container. And in Uruguay, the tax is calculated as a percentage of a fixed base, fixed by the government, and adjusted, and often adjusted, and it basically worked like a minimum amount of excise taxes. We also looked at country applied minimum price policies, and those are very popular in on alcoholic beverages, for example, with the example of Canada. That's a very famous example. And we did not find any on SSB in Latin America and in the Caribbean. And finally, we looked at price dispersion. So we used the ratio of the cheapest, we looked at the cheapest brand of sugar-sweetened carbonated drink, over the price of this cheaper brand over the price of the Coca-Cola bottle or can, the price that we had collected as a representation of the Monster brand. And that gives us kind of a proxy of price dispersion. And the lower this indicator, the larger the difference between the price of this internationally comparable brand that is Coca-Cola here, and the cheapest brand that could be found in the country of sugar-sweetened carbonated drinks. So finally, the main indicator, the indicator that we were all waiting for, and that Rosa mentioned, and all the presenters before mentioned, and that exists also for tobacco taxes. And here we focus particularly on excise tax share. As I explained, excise tax is the policy tool to raise the relative price of SSB. So we focus on excise taxes here. So here you see three beverages. You see sugar-sweetened carbonated drink for two different sizes, 355 milliliters and a liter. And then you see it for a liter of drink of the Monster brand. Before we dive into the results, there are some disclaimers on the right side that our data, for example, for Brazil, represent only the state of Rio de Janeiro. So it could not be validated by national authorities because it's not at the federal level. But this is okay because only the VAT actually varies at subnational level, but the excise tax is fixed at the federal level in Brazil, so it's still quite representative. And then in Venezuela, because prices were varying a lot around the time of the survey, it was hard to validate the price data. So let's look at those results. So first, let's focus on Peru and Chile. And why is that? Because of this tiered tax structure that I was mentioning before. So they applied this tiered ad valorem tax and the tier that based on sugar content and sugar concentration in the beverage. And here the three beverages clearly had were in the same range of sugar concentration, so the same rate applied to them. So that's why you see a similar excise tax share on the three beverages in these respective countries. Then let's look at Ecuador, for example, as the only country that applies such proportional amount specific tax per gram of sugar. And because here what's interesting is to look at the first two columns, so to look at the one on the small size sugar sweetened carbonated drink and the large size. Why? Because you see that there is we find a higher excise tax rate, tax share on the large size, and this can be explained because the more you increase the size of a beverage, the more sugar content in absolute value there will be in the beverage. So the higher the tax, but also the lower the price relative to the volume, because as I was explaining before, when the volume of a beverage increases, its price per milliliter tends to decrease. That's why you see an increase in between and a difference in between those two rates here, and it's important to notice. Then we can focus on Barbados and Mexico, which are arguably some of the most famous SSB taxes in the region, and if not the world. And these two countries were among the first to implement SSB taxes to improve health. And what we find is that actually in Mexico, for example, the specific excise tax that's applied actually represent only between 5 and 6.5% of retail prices. And in Barbados, and at the time, disclaimer here again, this data is from 2019. So since then, the tax, which was at first a 10% tax, is now a 20% tax. So here the results are based on the 10% tax. Here, why do we find a 6.5% excise tax share and not something closer to 10%? It's because what I was explaining before, the tax base here is fixed early in the value chain at the producer price. So it's based on a lower base than if it were applied on the final retail price. The good news, once again, is that Barbados decided to raise that tax to 20%. We can focus now also on fruit drinks, and what we see is that the results are mostly lower than for sugar-sweetened carbonated drink, or even that some countries just do not tax fruit drinks while they tax other type of SSBs. What we can say in the end on this graph also is that you see the regions separated in different color codes here. We see that mostly when you look at orange bars here, they are either lower or even a lot, we see a lot of zeros also, meaning that in general, excise taxes are found to be lower in the Caribbean compared to Latin America, except for Belize here that I chose to highlight. But the problem with the volumetric tax in Belize is that it does not cover fruit drinks, as you see. And now we're going to see it actually also applies to water. And Belize is not the only country that applies excise taxes on bottled water. Here you can see 4 in 27 countries that on which we could do our analysis. And taxing water is not helping to create any tax differential between healthier alternatives like water and unhealthy alternative like sugar-sweetened beverages. Another main results is that, as we see on the left on energy drink, that most countries apply excise taxes on energy drink if they apply taxes already on sugar-sweetened carbonated drinks. They mostly do not apply on sugar-sweetened milk drinks. And they are often exempted from such taxes on the basis that they are dairies. And even though they contain sugar, they are understood as dairies, so they are exempted from that tax. But they are sugar-sweetened beverages because sugar has been added to those dairy products. So because they contain such sugar that are often attractive to younger generations, and they should be part of excise taxes on SSB. So that's also one main finding here. So in our publication, we also looked at other taxes and excise taxes, but again, the main emphasis is on excise taxes. So here you see different color code for the different type of taxes. And here we represent, we look only at the small size of the internationally comparable brand of sugar-sweetened carbonated drinks. And here what we find is a median of 17.5%. This is for the total tax share, meaning the sum of all the share of all the taxes that apply on sugar-sweetened beverages. We see that this actual tax share is actually made more of the orange bars, which are VAT, than the green bars, which are the excise taxes. And the problem with VAT is that it applies on all the goods and services in the economy, or most of them. And so it does not change really the relative, it does not impact really relative price differences between SSB and other goods and services or other type of beverages like water. So that's why the policy recommendation is to use excise taxes rather than value-added or sales taxes. But here what we notice also is the blue and I think here yellow bars. And those are other taxes like custom charges or environmental levies or import duties. And we notice in the countries that are ranked at the top here, Saint Vincent and Grenadines, Antigua, that they represent a high share of the price. And this is mostly due because the most sold brands in those countries are often imported. And once again, not due to an excise tax that will be based on a health rationale. So just a quick recap here, we look at just median prices and median excise tax share, median total tax share. And what's interesting here quickly in this graph is that the median retail price, so the median between the prices in each country, between the countries that apply or the countries that do not apply, in the countries that apply an excise tax on SSB, the retail price tends to be lower. So this is a good thing compared to countries in which the excise tax is applied on SSB. So the good thing is excise tax work. They tend to lead to higher prices at the median here. And also what we looked at is if the total tax share is higher among countries that apply excise taxes on SSB. And of course, it's kind of obvious. Yes, the answer is yes. Here on the right, we give some median excise tax share results. So among the countries and only the countries that apply excise taxes on SSB, in our analysis, we find a 6% median excise tax share. So that's quite low. And in terms of total tax share, so here taking into account all those other taxes, we found a 16.9% median excise tax share. And here, all of those results are for sugar-sweetened carbonated drinks. The focus of this publication is not on prices again, and mostly on excise taxes, but also we publish the data that we found in our result on prices and on all those different type of taxes. So here, what is important is, again, not the prices, because what's important is actually the affordability of such beverages, and it's hard to measure this affordability with only one price point like we had for each beverage type. But we thought it was interesting still to show some data, and for example, here, the finding that the range of prices that we found for the internationally comparable brand of sugar-sweetened carbonated beverages in the region for the smaller size, those prices range from 46 cents in international dollars in St. Lucia to 1.77 in St. Vincent and the Grenadines, to give you an idea. And here again, we take into account purchasing power parity to be able to compare countries and their purchasing power, respective purchasing power. So you can find all these data, all this detail in the brochure that will be released very soon. We also provide an appendix in the article that we recently published in the Lancet Regional Health for the region of the Americas, and you can find all these detailed retail price data in the local currency, also in US dollar, in international dollar, and all the tax share for every type of tax. And this detail, I believe, and we believe that could be very useful when such exercise will be replicated, and also even more useful for researchers to be able to use that database to do research on excise taxes on SSB and all the taxes applied on SSB. And finally, even though that was not the main outcome of this publication, we looked also at the tax revenue from such taxes, because it's also part of the win-win-win that SSB taxes represent. One of the win is that it also brings additional tax revenue. It's hard to compare those tax revenue because first they are here in local currency, and it's also hard to compare them because population size of countries are different, the level of the tax is different, income levels are different, etc., etc. But the idea here is to show you examples. So if we take the example of Chile, for example, in the year here of 2018, it represented around the tax revenue from the SSB tax represented around $165 million in the year 2018. So these are significant tax revenue that can be extracted from SSB taxes. And why did we look at tax revenue? We actually, because we wanted to know which country uses this tax revenue for health, and we find that only two do so in the region, Dominica and Mexico. And in Dominica for the National Get Healthy campaign, and in Mexico for a lot of NCD prevention programs. And we know that soft earmarking, so earmarking a portion of the revenues here of such taxes can represent an immediate source of revenue, and can also help to improve the support by the public and also by the government for such taxes. So here recap to conclude. What are our main findings? First, it's encouraging to see that many countries apply excise taxes already on sugar-sweetened beverages, but most of them are not applied to maximize their public health impact. And there is a high degree of policy incoherence that remains as of today. So we saw that 12 out of 33 countries in Latin America and the Caribbean still do not apply national level excise taxes on SSB. That in most countries, these excise taxes represent less than 10% of the SSB retail prices, which is quite low. And in a lot of countries, way less than 10%, as we just saw. Ad valorem taxes, so taxes defined as a percentage of the value of the beverage, have usually a lower impact on the prices, mostly when they are applied early in the value chain. We also looked at specific taxes and if they are adjusted for inflation, and we found that only half are automatically adjusted for inflation. So there is, again, as I was saying, this risk of decreasing their real values over time. We also looked at at the fact that some excise taxes apply not only on SSB, but also water. And we find that 7 countries out of the 33, and not out of the 27 that we analyzed, 7 countries in total out of the 33 countries in Latin America and the Caribbean apply excise taxes on bottled water. And that represents a significant policy incoherence from a public health perspective. On fruit drinks or sugar-sweetened milk drinks, we found that even when excise taxes were applied, they were usually lower, and that a lot of countries actually exempt those products. We find that only 3 countries take into account sugar concentration when applying excise taxes on SSB. And again, this is highly recommended to do so. And we find that only 2 countries use earmarking, as I was just presenting. So we want to thank you, mostly our colleagues in Ministry of Finance, Trade, and Custom official, because it would not have been possible to do this study without you and your commitment to help us collect this data and to participate in this survey. And WHO, as Anne-Marie I'm sure will discuss, is now going to be scaling up this work at the global level. And of course, we look forward for continuing collaboration with you on this and this global monitoring. And I think I believe that it's thanks to this effort that we can be able to monitor SSB taxes and to provide better technical assistance. Finally, here are the deliverables, in a sense, the actual publications. So this work has been divided into 4 publications. So 3 are already published. So first, we published an article last year in the Pan American Journal of Public Health on the design specifically, and not looking at tax levels, but only on the design of such taxes. That is published, and you have the link here, and the link I'm sure has been shared in the chat. We recently published last month an article in the Lancet Regional Health Americas on the result that I just presented you today on comparing tax levels as a percentage of the price. We published last year the PAHO methodological note on the PAHO website. So you have a detailed methodology there. And then in the coming days, a brochure that wraps all those into one document will be released by WHO, and I'm sure you will either receive it or receive information about it in the coming days. So thank you, and here are more information from PAHO, WHO, and actually a recent that I wanted to notice, a recent policy brief that I think was published only yesterday, not only on SSB taxes, but looking at taxes on unhealthy food also. That is very interesting, and I will share it in the chat. Thank you very much.
Thank you very much, Maxime. It was so nice to hear all the results that you got from this new publication, and congratulations again. Bueno, ahora queremos dar paso al Dr. Fabio da Silva.
Now we're going to listen to Dr. Fabio da Silva Gomez, who's a nutritionist with a master's degree in population studies and social service, a PhD in collective health, and a postdoctoral degree in nutrition and public health. His specialty is nutritional analysis of populations and analysis of food and nutrition policies and programs. He's currently the regional advisor on nutrition and physical activities for the Americas at the Pan American Health Organization / World Health Organization, and he advises and supports countries in designing and implementing food and nutrition policies, as well as protecting such policies from competing interests. Doctor, go ahead, please. Thank you so much, Tatiana. And I wanted to talk about this indicator and the work that we have done around this area. Maxine's presentation had a lot more information than the tax share, especially excise taxes. That's the most important piece of information. But I would like to talk about how this particular indicator and the other indicating elements that we have on the structure and other tax-related components are useful both in supporting the agenda around taxes on SSBs in our region and other regions, but also how this work and taxing SSBs are part of a broader agenda that has to do with regulating processed and ultra-processed foods, so we can address the issue of obesity and other non-communicable diseases that are related to poor diet. So we will begin with the indicator and see how it plays out with the agenda and helps us advance this agenda on taxes in our region. We know, like Rosa said at the very beginning, that there was an initial step and one of the most significant steps, by the way, in developing benchmarks and recommending standards for countries that they could use in their taxing strategies. Up to now, in the case of tobacco taxes, clearly there are elements that go beyond the definition of excise tax shares on beverage prices. And this indicator that is being presented today is one of the most significant steps that we have been able to take as part of these initial steps, so that from now on, we can develop different elements and learn from these indicators to see how we can achieve this benchmark for countries to have better guidance when developing and implementing taxes in their countries. So this is a key tool to make progress around this specific agenda. And then in terms of a challenge that we have for SSBs in our region and around the world is that when we start analyzing those data and indicators for tobacco product taxes, there are already countries that have a fraction of their taxes earmarked and that portion is significantly higher to what we saw today during Maxine's presentation as a result of this study. This means that we're going to have to not only continue monitoring this indicator, but also to try to ensure that the countries can make more progress in taxing strategies so that these benchmarks may be reflective of country experiences and to also have common ground to define these benchmarks either at the regional or global level. And that is important both for SSB tax, the SSB tax agenda, as well as for the broader agenda that is part of this package of policies that we must adopt in order to effectively reduce the supply and demand for these products that we know that not only compromise health, but also food systems in the countries of the region. And talking about that, we know that taxes will address a fundamental aspect, which is affordability. So we must, in a cost-effective manner, reduce affordability. But we know that reducing the supply and demand must go beyond reducing affordability. So together with this implementation of taxes, like we've seen as a result of this set of indicators, we must also have the countries complement these measures with policies aimed at reducing, for example, the stimulus for consumption of these products, such as advertising or the way in which information is shown on product labeling for sugary drinks or other ultra processed foods that are part of this set of products and practices that are promoted and that continue to keep our population obese. So it's very important to have a clear understanding of this necessary set of policies, because unlike other types of nutrition related issues, such as, for example, undernourishment or malnutrition, from the evolutionary point of view, we have developed a lot of mechanisms aimed at preventing weight loss in order to outlive adverse situations or short supply. But from the individual point of view, and even more so from the collective or population level, um, we don't have tools to stop weight gain from the point of view of the way in which our bodies work. This means, and that is why we need to reduce malnutrition in several countries in 4 or 5 years' time. But the difficulty that we have, even if we have effective policies in place for a long time, reducing obesity as quickly as we must address malnutrition is key. This means that not only is it key for us to have effective regulatory practices, but also for these effective regulatory practices to be implemented in a sustainable manner
Entonces,
and over a long
además de tener
time.
políticas de regulación de
So, in addition to having front of labeling regulation policies or advertising regulation policies or something that hinders access to those products, we need to use taxes so that we can have those policies, but also to make sure that they are implemented efficiently over time. This is absolutely key if we want to be successful in preventing obesity and other poor diet related diseases. So in this sense, this work and this indicator will put us along the lines of what Rosa said at the very beginning. That is to say, we're talking about not only implementing policies per se, but also implementing policies that are developed in a way that makes them effective and that supplement another set of policies of this broader package of policies that could sustain these achievements and enable us to continue to move forward so that people can have a better diet and have better public health outcomes. And finally, one of the most critical elements that we have found, and we believe, by the way, that this indicator is going to be a tool that would also help countries and authorities from the different government sectors and civil society to make progress in fostering these types of actions and other regulatory actions, is the importance of having a very clear picture of those decision making policy spaces that can be protected from interference from actors that go against public health actions or that are after their own corporate or private interests. So in that sense, I believe that we hope this indicator and this set of indicators will help countries move forward in their approaches and to be able to apply or implement taxes in a better and more effective way so we can promote healthy eating and better public health outcomes. And we will continue to improve the benchmarks, like I said, that we can give our countries so they can have better guidance and achieve the ultimate goal of having healthier populations and better public health outcomes. Thank you very much. Thank you so much, Fabio, for your presentation. It is very important to acknowledge that these measures have both a public health as well as a tax side to them. Now we're going to move on to the panel. We're going to be hearing comments from some of the people, both from health institutions, economic institutions, government agencies, as well as international organizations. And so without further ado, we are going to move on to comments from Amari Peruti. So I would like to welcome her. I'm going to introduce her in English.
WHO since 2001. She works in the Fiscal Policies for Health Unit in the Health Promotion Department in Geneva, Switzerland. Her work focuses on tobacco taxation, and she has been providing technical support since 2009 to countries' Ministry of Finance officials, as well as trainings on tobacco taxation in multi-country workshops aimed at ministries of health and finance officials. She has been involved in work on tobacco trade, tobacco growing, alternatives to tobacco, and sustainable financing of tobacco control measures, particularly in developing countries. Ms. Peruti holds an MSc in Economics from the University of Montreal and a master's degree in public health from the London School of Hygiene and Tropical Medicine. Thank you, Anne-Marie, for joining us today. The floor is yours.
Thank you very much for the invitation. I'm very happy to be speaking on this subject. It's such an exciting opportunity to see how the work on tobacco tax indicators has expanded to other products. I would first maybe like to reflect on the relevance of this exercise, drawing from the experience of tobacco. A lot has been said already about that, so I may be repeating some of the thoughts that have been provided by colleagues who spoke before. So as we know, for tobacco, we have a comprehensive coverage of countries globally for over 185 countries, where we look into different aspects of tobacco taxation, a bit similar to what the data that Maxime has presented for SSBs, the tax share indicator, price levels, affordability, information on tax structure, etc. And this has been extremely beneficial to tobacco tax policy development in the context of tobacco control. So from also mainly from health perspective, of course. It has helped, so maybe the first point is that this has been very useful because it has helped follow the evolution of tobacco taxation, the advancements and setbacks in some countries over a relatively long time period or average not very long term, but midterm, because we have the data that's been published. The latest is since 2008 up to 2020, so over 10 years of coverage. This is data at country level, and where we can dive into what's happening at country level, but also comparing between countries, which has been also an important aspect of policy discussion. It has also helped us understand the different policy approaches that have been adopted around the globe, and has helped us identify and confirms the best practices in terms of tax policy, which is extremely important for countries that are looking into the best approaches for tax policy development. This has also helped identify and share country successes, inciting other countries to follow suit. It's been also a very useful tool for researchers for analysis of impact of tax increases and tax structure. It has made also tax policy more palatable to tobacco control advocates and has been effectively used to push further the tobacco tax agenda among key policymakers, such as ministries of finance officials. So based on lessons learned, PAHO took the initiative to use this approach and apply it to sugar-sweetened beverages. And this was really a brilliant idea, which has proven that the tobacco approach is indeed replicable for other unhealthy products such as SSBs, even if there may be some fundamental differences in the type of product that is compared, but still possible. So building on the seminal work of PAHO in this area, especially with regards to the process followed, the tools developed, the products identified and defined, and building on the feedback received from respondents at country level, even if it's limited to one region, the Americas, expanding this data collection exercise at global level will be possible because of this solid experience. And that's been already mentioned by Dr. Hennis, by Rosa and Maxime. So indeed, thanks to the successful experience of PAHO, WHO is currently working to undertake this exercise at the global level by collecting data from countries and compiling the tax share and affordability indicators to better understand who's doing what. And with the increasing interest of countries around the world that's being expressed for the adoption of SSB taxes, this data collection initiative will help build further the evidence for the establishment of best practice and guidance in the design of SSB taxes. So we're look forward to this exercise and to also help advance knowledge on SSB taxes better, not just in PAHO, but in countries around the world. Thank you.
Thank you, Anne-Marie. Fabio, the floor is...
Y ahora vamos a pasar a la presentación de Miriam.
Now we will hear from Miriam Yepes, who is correctly Director of the Economic Intelligence and Tax Optimization Unit of the Ministry of Finance. This is to design and implement tax policy, providing economic analysis related to the economic proposals. The experience includes excise taxes on alcoholic beverages and tobacco, and she has worked on designing corporate taxes, personal income taxes, VAT, etc. So welcome, Miriam. Good morning, everyone, and thank you for your invitation. It is a pleasure to be here. I think that there is an issue that I would like to take up. I have some comments I want to make, and I want to present them within the framework of tax policy. It seems to me that it's very interesting that the exercise that is being carried out for SSBs is an exercise that right from the beginning, because the truth is we have a lot of information, a lot of work has been done in the area of tobacco in recent years. But I think that the work is now incipient regarding taxing SSBs and alcoholic beverages. So let me tell you about the experience of the Ministry of Finance here in Peru regarding taxation and how that experience is part of our discussion today. In Peru, we have taxes that are specific taxes, excise taxes on many different things, and this has been the case for 40 or 50 years. But those taxes were designed as initially, they were taxes on luxury goods. So that means that alcohol, tobacco, SSBs have been taxed for a long time in Peru. But the concept, the idea was always that they were luxury goods. And something like 15 years ago, the Ministry of the Economy and Finance in Peru began to think more than these being luxury goods, they are goods that have a negative effect on both the health and the environment. So that has been the guiding principle for tax policy in Peru. And in this area, and back in, I don't know, but about 2018, we did several changes to our excise taxes, and we changed them. We increased the tax load, the tax burden for many items, and there was a significant increase in the taxes on beverages. I'm not talking only about SSBs, I'm talking about beverages in general. Now, before 2018, all beverages, this in keeping with our regulations, all beverages, with the exception of water, were taxed at 17%. In 2018, in May 2018, what we did was we amended the law, And we took advantage of the fact that back then there was a discussion, there were regulations having to do with the healthy diet law. There was also provisions having to do with labeling. So what we said was, okay, if food labeling that is going to begin, that will soon begin, and it said that these beverages were not healthy. So, and back then, right, then all the beverages were taxed with 17. So we said anything over 6 degrees will have a tax. So that meant that in the following months, what we found was that generally speaking, most of the carbonated beverages reduced their sugar content to less than 6 degrees per ml. So that affected us from the tax and the health standpoint, because if we wanted to reduce sugar consumption, what we found was that the industry quickly cut the sugar level because we have a group of well-known beverages. There was a group of 10, and in 6 months, they had reduced the sugar content to less than 6 grams per ml. Only one was above that percentage. So that was good. And another thing that we introduced at that time was we introduced a general term. And what happened? There were some carbonated beverages that said that they had 1 gram of vitamin C, and therefore they were marketing themselves as being healthy, and they were kept outside of the system. So what we did, and that was a broad discussion that we had with the Ministry of Health, what we did was we said we're taxing everything, even natural juices, because the Minister of Health said us, these are natural beverages, they're extracts of orange juice, and yes, their vitamin content may be high, but their content in sugar is also very high, and that's not healthy. So it's something very positive. And something else in Peru, even light beverages, those that don't contain sugar, are taxed. Now, back then, the industry said, how are you going to tax a beverage with 0 sugar? And there, WHO came to our assistance. They gave us a study where they compared industries, showing how beverages that are not based on sugar are not healthy either. So I'm not going to go into details, but what we have done is standardize all beverages. All beverages are taxed with a couple of exceptions. That would be serum, that is identified by the law, and now all beverages, not only carbonated beverages, but all juices, etc., have a tax of 12%. 17% is the general level. It is lower if it contains less than 5 grams. We have been working on this with the Ministry of Health, and also the beverages with more than 5 grams per ml pay a higher tax. Now, what we are seeing is that, and this is part of this same study, what we are seeing is that even though in Peru we have a participation of tax share that's high for the region, when you look at the study, you're going to see that just because of our tax share being so high, that doesn't mean that the price is higher, even if you look at purchasing power parity. And this has to do with the strategies of industry. And I think that this first study is an important step in that direction, because we really don't know what the industry strategy is. In Peru, all beverages, and that is something that Maxime said, in Peru, all beverages the tax share is 17.9%, but not all beverages pay the same amount of tax. What do I mean? I mean that the price difference between a half liter and a 3-liter beverage, when you look at the price difference, the price per liter, you find that the beverages that are higher volume pay per liter a price that is 40% below a half a liter. So what does that mean? That means that a beverage per liter pays in soles, our national currency, more tax in soles per volume than a 3-liter in terms of soles per volume. So what we have is the industry strategy, which is to make bottles that are bigger and bigger. And those bottles, 20 years ago, 1 liter was the most frequent size, and then it went to 1.5. And I don't know now per volume which size is sold the most. But the bigger the bottle, the less tax paid. And so I think that what Ecuador is doing is very interesting. It seems they have a mix system where they are charging a minimum tax. And that minimum means that the difference in taxes paid for a 3-liter beverage compared to a half-liter volume doesn't represent such a significant difference. So here the thought would be, we need to learn more about how the industry is operating, because this whole idea of volume strategy, pricing strategy, it seems to me that we really aren't well acquainted with what the strategy is. And if the ultimate strategy of having an excise tax is to change consumption habits, right? So we need to look at price to produce a change in people's behavior and also the behavior of the industry. So perhaps the strategy is to sell bigger and bigger bottles. And perhaps that means that there's less consumption of half-liter bottles because people are buying 3-liter bottles. So that is something we have to think through to see how the industry is operating, what its strategy is like. And also, this is something that needs to be studied. What is the volume? How representative is a half-liter bottle or a 3-liter bottle? That is a question that I don't have an answer to, but I think it's something that does require some thought. How can we rein in? How can we affect behavior, not only of persons, but of the industry to promote health in our countries? That's all. Thank you. Thank you, Miriam. Those are very good examples of the need for innovation, how much policy innovation we need in this area. When we begin to look at other groups of products, for example, to be clear on the strategies being used to. Another interesting thing was when you talked about labeling. Now we're going to hear from Arantxa Corchero, who fortunately was able to join us today. Arantxa is a health economist and works as a researcher in the direction of economics of the health system and the National Institute of Public Health, and has a PhD from Johns Hopkins University, and she is a national researcher in medical sciences. So Arantxa Corchero, you now have the floor. Thank you. Thank you, Fabio. I haven't been able to turn on my camera, but I hope you can hear me. We can hear you very well. Thank you. Well, thank you. Unfortunately, the speaker was not able to attend. I have read his articles And this information allows us to compare indicators.
Sobre todo porque también quiero que ellos
We
basen
can compare the different taxes that exist. And this is very interesting because to see that Mexico, in fact, was one of the pioneers, one of the first to implement an excise tax on SSBs. And if you look at in terms of the percentage that is a tax is relatively low. And it's interesting not only to be able to have this as a target for public policy, to see exactly where you stand and how much you can increase the tax. It's very interesting that the beverage industry in Mexico has always said that our beverage tax is very high. And this study shows that that's not the case. Actually, in Mexico, it's quite low. So here I'm thinking out loud, but I think it would be very interesting to add to the tax share indicator. It would be good to add where assessments have been made, what the impact on consumption has been. You would think that the higher the tax share, the higher the impact on consumption. But it would be really interesting to do a study in that direction. Also, this exercise is that it helps show that excise taxes to see which it depends on the objective. In the case of Mexico, I think sugar content. Now, I think it's valid to make a comparison with other countries. In the case of Mexico, for example, that could be really important in terms of increasing taxes. We would always have to make sure that these are optimal taxes in terms of being sure of minimizing the impact on employment and on the income of the poorest members of society. But of course, this could be compensated with the fiscal revenue. It would be important to be able to earmark at least part of the fiscal revenue. And in the case of Mexico, I should say that taxes are not earmarked. Now, the Senate did make that proposal, the possibility of earmarking certain revenues, but that has not been approved. But if there is any negative impact, that is something that could be offset.
Of course, like we've always heard, taxes are a very important action. They increase prices and consumption goes down. That's the most solid evidence we had. There's been systematic reviews. There's a very significant one that just came out that shows that consumption does actually go down. And we are yet to prove whether they can be substituted with other drinks or food. And I see in the publication and the charts that Maxime showed that there are very few countries that still tax high energy foods that are not non-essential. And that's important because it's a way of reducing potential substitutes. And in another way, it covers foods and beverages that are not only harmful for the health, but for environment as well. And I believe this is something that we must emphasize, the negative impact on health and on the environment, following what the Lancet says. And of course, we always have to combine this, like Fabio said, with other action, like regulating advertising, regulating the offer in schools of foods and drinks. Hopefully, that could also be done outside of schools. And another thing we must think about is how to regulate the number of stores that sell these types of food and drinks. And finally, I believe we should incentivize the consumption of healthy goods that are not advertised. And a way of doing it could be, for example, through grants that can be given with tax revenues from these taxes, with the ultimate goal, of course, of having a significant reform on food systems in our countries. Well, thank you very much, Fabio, and thank you, everyone. This concludes my comments.
Muchas gracias, Arantxa. Muchísimas
Thank you
gracias.
so much, Arantxa, for your presentation and your comments. It is very important to know what the feeling is and how these taxes impact the reality in the countries. I am now going to switch to English because I'm going to introduce economist Sharon Olson.
With the Domestic Resource Mobilization Unit of the World Bank, where her work focuses on fiscal policy and taxation with a focus on health taxes. In her previous role at the World Bank, she worked on multi-stakeholder engagement and coalition, building approaches to facilitate public sector reforms in a wide range of countries. Sharon is the co-author of a book, A Better Globalization, Legitimacy, Governance, and Reform with Kemal Dervis. She has done work towards a PhD in political economy from the Johns Hopkins School of Advanced International Studies, an MA in International Relations, Conflict Management and International Economics from SAIS, and a BA in Economics from the Boğaziçi University in Turkey. It is a pleasure, Sharon, to have you here with us. So please go ahead, the floor is yours.
Thank you, Tatiana. I would like to start by saying that these are very challenging times for the world economy in general and for economies of the region. In fact, the World Bank just a few days ago published a global economic prospects report. I invite all our colleagues to sort of have a look at that. There we discuss the inflationary pressures and the combined need for fiscal consolidation, creating a quite complex environment for authorities to navigate. So what I have observed in the recent years is that the ministries of finance are looking at sugar-sweetened beverage excise taxes as an interesting sort of revenue source. Yet at the same time, I think currently there is a lot of concern about the inflationary impact. And of course, authorities are also interested on the impact on households. How does it affect household incomes? So it creates a complex policy environment. And I think that may be the reason behind while in the early days of COVID, we were expecting to see more reform, more introduction of rate increases or introduction of SSP taxes in countries around the globe and in the region. And somehow the introduction or increase in rates have not been commensurate. And I think this has something to do with the current environment. What is really helpful is to have high quality analytics and a lot of good evidence for authorities to make good decisions. And I think this report, this work by PAHO, in that sense, is a very welcome contribution, and congratulations to the team. As Rosa and Maxim's presentations made it clear, SSP excises need to be designed and implemented in a thoughtful manner to fulfill their expected role of reducing consumption and in turn to ensure that there is health impact. I think the primary focus needs to be health impact, but that's very dependent not just on rates or an introduction of any type of tax. It's dependent on the design, it's dependent on the structure, and it's also dependent on implementation capacity. We heard in Anne-Marie's remarks that success of tobacco tax policies in low and middle income countries has significantly been aided by the clear benchmarks that World Bank, WHO, I think put forward. The WHO took that benchmarking exercise really forward, doing it every 2 years, helping authorities with questions like, how do I compare my country with others? Is my tax share lower or higher? How are we changing over time? Is the tax share increasing or decreasing? And also giving policymakers an easy to understand metric, but also allowing civil society to hold their governments to account. with the really rapid progress in the sugar-sweetened beverage excise taxation field, I think many countries around the world are starting to experiment with these taxes, at least consider them. Therefore, there's a lot of variety in tax structures, tax rates, and design. So it's a very exciting time to be working on this. And as the presentations and discussions so far identified, we don't have as yet the same clear and easy to understand benchmark on SSP taxes. So this is a very welcome effort. They are significantly more difficult to benchmark because of the variation in the products. We have a lot of product types, carbonated drinks, juices, energy drinks, iced teas, coffees, concentrates, but also huge heterogeneity in the retail environments and the package sizes, which in turn result in greater price heterogeneity than tobacco products and significant variation in the sugar content. And I think Maxim's presentation was excellent, sharing these limitations. We also heard from Miriam and Hugo sharing country experiences, making it clear how important to take these dynamics into account at the country level. I just want to close by saying PAHO team has done an exceptional job in doing a lot of hard work in terms of coming to grips with the challenges of collecting and presenting data in a standardized manner, given the variation in products and prices. I think there are already very valuable insights, such as design the SSP taxes to take full advantage of the health impact, do not, disadvantage healthy alternatives such as water and many more. I look forward to continuation and growth of this work. And with that, I'll hand over back to our moderators. Thank you. Thank you for the opportunity to be here.
Thank you very much, Sharon. And we'll move now to hear the comments from Dr. Abdullahi Abdul Qadri. He is the coordinator of the Statistics and Social Development Unit of the United Nations Economic Commission for Latin America and the Caribbean, the ECLAC, sub-regional headquarters for the Caribbean, Port of Spain, Trinidad and Tobago. He holds a PhD degree in economics from Kansas State University and completed postdoctoral training in health economics at the U.S. Centers for Disease Control and Prevention, the CDC. Prior joining the ECLAC, Mr. Abdul Qadri was a professor of applied economics at the University of the West Indies, Mona campus, where he also served as the Associate Dean for Research and Innovation in the Faculty of Social Sciences between 2010 and 2013. Dr. Abdul Qadri has published on diverse topics related to health and the environment, including a recent study on the impacts of non-communicable diseases on the sustainable development of Caribbean countries. Thank you very much, Dr. Abdul Qadri, and the floor is yours. Welcome.
Thank you very much, Fabio, for the introduction, and also would like to join others in congratulating you and PAHO colleagues for an excellent study. I read through the paper, but I even got more from the presentations done by Rosa, yourself, and Maxine. So it is quite very informative, and most of the things that ordinarily I will add to it, you've already mentioned them. But just to highlight from a sub-regional perspective, just to share some of the insights from the study and the broader issue of excise taxation, with particular reference to unhealthy products or to improve our health. What the study has done is to present a very useful tool, a standardized indicator for looking at the comparing taxes, excise taxes on SSB more broad. And this is something that is very useful. And as many have mentioned already today, that taxes, not all taxes are created equally. You have different kind of tax structures, the base at which these different forms of taxation are applied. And a number of these will make one single, if you just look at the tax rate without reference to whether it's amount-based or is ad valorem tax, then you may be making conclusions that may not be factual. So having a standardized indicator as the PAHO study and the publication as presented is very useful. For the Caribbean in particular, it facilitates sub-regional policy coherence. And with respect to that, I might just cite the current Caribbean Cooperation in Health Phase 4, which is in effect, and that has 5 strategic priority areas. One of those priority areas is that data and evidence for decision-making and accountability. So that's a priority for the Caribbean sub-region, to have data and evidence for decision-making and accountability. And the outcome of that priority area is to have regional capacity enhanced to generate and use quality data and evidence for more effective policy, programs, and monitoring. And I see this indicator as contributing to that outcome, and by so doing, it's very relevant for the Caribbean. And based on this study and the results that have been presented today, we see the variation in the Caribbean and even in Latin America and the Caribbean, but more so in the Caribbean, where we have out of 14 countries, as was presented earlier by Maxime, only 6 countries apply excise taxes. And if we even look further, you see that that's for the 350 ml size sugar-carbonated drinks. And for the larger size, there are only 5 countries that apply excise taxes. The interesting thing is that there are taxes also on bottled water. But when you look further, only 2 countries in the Caribbean currently apply taxes, excise taxes to bottled water. But in terms of the share of total taxes in the price of these different products, you will see that its share of taxes generally on bottled water is quite high, even though only 2 Caribbean countries apply excise taxes. And so I looked at the figures, and I just to further add to what Maxime presented. For bottled water, the range, the median tax rate, or the share of tax, the median share of taxes, is for bottled water is between 9.2 for the total tax share, 9.2 to 33.6%. That compares very well with sugar-sweetened carbonated drinks, the small size, with the range of 8.9 to 38.3%. And for the larger size, the 1,000 ml capacity, 4.3 to 30.7% in terms of total tax share. But with the excise tax share, you have for the 2 countries that apply excise taxes to bottled water, the country with the lower rate has a tax share of 9.2%, and the one with a higher rate at 19.2%. So irrespective of whether excise taxes are applied to bottled water, what you see is that there is a high rate of tax as a fraction of the total price of bottled water, comparable to the sugar-sweetened beverages, which relates to the issue that has been highlighted by several speakers today, that if you look at the health purpose of using excise taxes is to control or to regulate consumption of unhealthy diet. So if without excise taxes on bottled water is this high, then that's really explained the point that Maxime was raising, that most of these taxes in the Caribbean may not have been implemented for health purposes, which now brings up the issue of how do we now change the narrative? How do we engage the ministries of finance and to engage them in seeing the benefits of using excise taxes, not just for the generation of public revenue, but to use that as a means of incentivizing healthy behaviors, healthy eating, healthy diet, and at the same time, increasing revenue. And when you see that for looking at the broader Latin American and the Caribbean countries, that only 2 countries actually earmark a percentage of the excise taxes for health purposes, for healthcare financing. It goes to show that there is the use of excise taxes for health promotion or healthcare financing hasn't been well integrated in the public finance apparatus or tools of the region. So that's an issue that this study has highlighted very well, and I think there needs to be more done with respect to engaging enhancing the engagement and facilitating that dialogue between the health officials and the finance, those who are in charge of revenue generation in the ministries of health, and even at the higher authority of decision making at the cabinet level, where they see the benefit of excise taxes, and to promote, not just to generate revenue, but to incentivize healthy behavior. When we look at this in the context of NCDs, where the Caribbean sub-region has a very high prevalence rate, and more importantly, with respect to childhood obesity, where it's been reported by the Caribbean Health Coalition and other agencies working in this area, that the prevalence is above 30%, 33% in some cases. That's very high. And what that shows is that there's a high risk of a higher rate of obesity in the future population. So, and we all know what are sugar-sweetened beverages, how they serve as a risk factor for obesity and for diabetes. So, if we focus on the youth who are likely to be more responsive to price and income to price changes, for example, when we impose taxes, is to raise the price of the goods. And if we look at youth that have a high rate of obesity in the Caribbean, who are more likely to have to be sensitive to price increases because of their lower income, then it becomes a policy issue where we need to focus on how do we use this tool as a fiscal policy in order to incentivize healthy behavior and at the same time generating revenue. But that revenue has to be adequately earmarked for health promotion, for improving health, for healthcare financing. And when we relate to the experience of the Caribbean countries with respect to COVID-19, which may be similar to many other countries, is that due to the lockdown, there was the increase in consumption of unhealthy diet, where many restaurants closed and many people were restricted from having access to the fresh fruit and vegetables, and may end up consuming unhealthy diet or cheap diet, and that increases the risk of their susceptibility to obesity. And in such a situation, we've also related to the COVID-19 response by the government. We've seen increases in social spending, which at the time when governments have lower revenue because of the economic shutdown, they are increasing expenditure on social services. So that now brings an opportunity for looking at how do we use excise taxes once we have a very standardized indicator which we could do a general regional comparison to now see how that could be used in a way to generate additional revenue whilst we target earmarking those revenue for healthy behavior. So just to recap, basically we need to do more advocacy in terms of what benefit lies in using excise taxes for healthy, to promote healthy behavior with respect to NCDs. Thank you very much, and follow the discussion.
Thank you very much. Thank you very much, Doctor. Thank you so much. It's very nice to hear from you again. Our last commentator will be Dr. Veronica Shaw. Dr. Veronica has 20 years of experience working on NCDs issues in both civil society and public administration. Most recently, she was the National Director of Health Promotion and NCD Control of the Ministry of Health in Argentina, where she was in charge of more than 10 national programs, including nutrition and obesity prevention, tobacco control, diabetes, and cardiovascular diseases, among others. From 2007 to 2017, Dr. Veronica Shaw co-founded and served as executive director of the Inter-American Heart Foundation in Argentina, an NGO working on advocacy and research in non-communicable diseases. Dr. Shaw is an author of more than 40 papers in peer-reviewed journals, was the project leader on more than 10 competitive grants, and the recipient of multiple awards and distinctions. So it's a pleasure to have her here. Dr. Veronica, the floor is yours.
Buenos días a todos y a todas. ¿Me escuchan
Good
bien?
morning or good afternoon, everyone. Can you hear me?
Sí, perfecto, muchas gracias.
Bueno, en primer lugar y en representación del Global
Yes.
Health
First of all, and representing
que represento,
my organization on health calculators, I wanted to thank my friends and colleagues at PAHO for the invitation. I represent the Global Health Advocacy Incubator, and I congratulate you on this initiative. I'm sure that this will help advance tax policies on SSBs. Now, from our perspective, in the Global Health Advocacy Incubator, we support civil society organizations in countries to help them carry out advocacy campaigns to encourage dietary policies. Here we have initiatives financed by Bloomberg and other international partners to support these initiatives. Now in the incubator, we are supporting SSB taxation in 12 countries, some in this region, others in Africa and Asia. And I wanted to say something to complement what others have said about this paper and its implications. And that has to do with the interference of industry as one of the major challenges that we face in all of the countries where we are supporting food policy campaigns to reduce the consumption of ultra-processed products and especially the sugar-sweetened beverages. The major challenge we face is the industry fighting policy, and in other cases, they adduce loss of jobs or loss of economic revenues. And other important arguments brought by industry is that fiscal policies don't work. Now, this is the major challenge, the interference of the industry. And that ties in with other problems that we see on the part of civil society. And that is that these programs tend to be technically complex. And also there's debate about the best ways of achieving a policy set by WHO of increasing SSB prices by 20%, because there is evidence that these policies do work, and that recommendation of increasing prices by 20%, but nonetheless, there is a lack of clarity on what the best tools are to accomplish that purpose. So the interference of industry, the technical complexity, the lack of benchmarks, all of this creates a vicious cycle, because the risk is that the approval of fiscal policies that are not designed for public health objectives wind up reinforcing the industry's arguments. They reinforce the argument that these policies are not effective, when we know that they are effective if they are properly designed. So I wanted to say that. And I also wanted to say why we see this paper as a major contribution for civil society. One of the previous speakers said this, but I wanted to reinforce that. Now, fiscal measures are a complex issue. So having a simplification with clear recommendations allows for a clear discussion for advocacy purposes. And here it is made clear that countries can now analyze where they stand in their country compared to other countries worldwide, and to understand that the mere existence of a tax on SSBs does not mean that that tax is going to be effective to accomplish public health purposes, which is to reduce the consumption of SSBs and make these products less affordable in a sustainable fashion, and also allow us to address the weaknesses in the policies. For example, the burden is less than what is shown in the policy, or sometimes we see that these taxes are not selective as they would be with an VAT, or that the tax is not applied to certain types of sugared beverages, and that creates a substitution of one sugary beverage with another. So it's important that there be straightforward language that can be used by civil society so as to simplify advocacy campaigns. This is something we have already experienced working with tobacco, as Rosa and others said. So having a clear benchmark of 70% of excise taxes on tobacco and clear characteristics of how those taxes have to be structured, all of this is very helpful and allows us to move forward in terms of charging a tax on tobacco worldwide, and to continue to advance along similar lines for sugar-sweetened beverages. Lastly, I want to say we support the continuity of this work from the standpoint of the incubator. We hope to help develop future benchmarks, not only qualitative, looking at a minimum level of tax to be paid, but also qualitatively. We have to continue to discuss what the best tools are for fiscal structures to promote these policies that improve public health. And lastly, I wanted to say that from our perspective, this measure has to be viewed as one part of a package. It has to be a comprehensive approach to health policies. And in that connection, we have to continue to seek greater evidence. How can we avoid substituting sugar with artificial sweeteners? We know that that has happened here in Chile and in other countries too. And to a certain extent, fiscal measures may wind up producing collateral damage or having a negative effect on health. For example, we know that we now have evidence about artificial sweeteners and their prejudicial effect on health. So how can we have policies that do not lead to replacing sugar with artificial sweeteners? So thank you. And with that, I return the floor to our moderator. Thank you, Veronica. How nice to hear from you. And I wanted to thank all of the participants, our panelists, our speakers, for being with us. It's been a pleasure to hear from all of you, but unfortunately, we are short on time. We don't have time for a Q&A, but our audience has been using the chat feature quite actively. So please look at the answers shared through the chat. And lastly, I am going to turn the floor over to Rosa Sandoval for some closing remarks. Thank you, Tatiana. I thank everyone who has been with us today. Especially, I want to thank our colleagues who have shared their comments and reactions with us. But I did want to conclude our session, although we are a few minutes late, with a couple of messages. First of all, I wanted to begin with the comment just made by Veronica, and that is that these taxes on SSBs in America, Latin America, and the Caribbean, this is being implemented, but sometimes we see that the design is not effective. Or to be positive, I should say that there is a lot of room for improvement in the design of these taxes in countries so that they will be in keeping with both fiscal and health objectives. Now, at the end of Maxime's presentation, we saw a lot of very interesting things, and I wanted to highlight some of them. For example, juices or sweetened milk products. In many countries, they are exempt from paying that tax, so the tax is lower. But the fact that we have 7 countries that also tax water, that is something that basically misses the opportunity of creating a price differential between those harmful products and the healthy products. So the fact that we have 3 countries that only 3 countries apply these taxes, looking at the concentration of sugar, and only in 3 countries is there earmarking of these revenues for health campaigns. So once again, we have to look at the design of this instrument in our countries, in our region. And now, as a second point, I would like to emphasize the selection of products. The fact that the study covers only some products doesn't mean that PAHO thinks that only certain products should be taxed. No, that was done in order to be able to come up with our calculations. We selected 4 categories of products that would come under SSB, and one is a control group, water. So I reinforced that because there have been some questions in the Q&A, but I just wanted to take this opportunity to reinforce that point. And then lastly, the comments and the homework that we're taking away, things that we have to work on together, working with our panelists today. Medium was reminding us of how important it is to have more information on consumption data, market share. Arantxa talked about the impact on consumption. And also Arantxa referred to beginning to put on the table a discussion of measures to stimulate the consumption of healthy products and looking at the possibility of subsidies. That is something that we have to do still here at PAHO, and that all of this could be financed with the tax revenue obtained from SSBs. Now, also, there was reference to our current economic framework and the concerns being faced by the ministries of finance. So perhaps we need to talk more about how we can approach these taxes so they can contribute to the development of our countries. Abdul referred to the importance of changing the narrative, how indicators like this can help us change our narrative in terms of what these taxes mean, and especially with the Ministry of Finance. And then lastly, all of the work done by PAHO about responding to the needs of our member states, and this goes hand in hand with other organizations, the UN system, intergovernmental organizations like the World Bank, like ECLAC, and of course, working side by side with civil society. And it was a pleasure to hear from Veronica saying that this work is going to contribute to our work with civil society. And then lastly, the final message is this is just one of the tools, but it has to be part of a complete toolkit. So thank you very much. This brochure is soon to be posted on our webpage. Thank you very much for being with us, and I hope to see you soon.